Hello, my name is Ricky Walter. Hello, my name is Ricky Walter, and I am trying something today that scares me to death, and that is going live on a social media platform. I am a licensed professional counselor. I have been practicing in private practice for some time now, um, and what I would like to do beginning tonight, and I will be going on with this every night if I can, is to talk and open up discussions about mental illness, which is very close to my heart. I see more and more people dealing with issues. I'm getting more and more referrals for children who are being referred because they're having suicidal ideations. There was a recent incident that happened this year, as a matter of fact, this month, of a 10-year-old child who uh, committed suicide in another state. I think part of the reason why we're having more and more kids talk about it is because I don't think we understand that this is such a big issue. And for many years we've buried it. We've hid away. We've run away from it. We've not addressed it. So part of my platform is opening this discussion and allowing people to talk and say whatever is bothering you and dealing with you, there is a place for you to go and get help. Um, as I'm and I specialize in working with children and adolescents. Most of those children that I have an opportunity to see are children who are dealing with attention deficit hyperactivity disorder and depression and anxiety issues. And and for a number of years, we've thought that children shouldn't be going through anything. Oh, children don't have any problems. Well, they inherit or they internalize the problems that they are dealing with in their environment. For instance, if a child is, if there is stress related issues regarding marriage, or a child is, if a parent is dealing with sickness or lack, or there's no money, or there's issues regarding, poverty, or uh, children actually do internalize those stressors, and oftentimes you will see that coming out in behavior. So I want to open up an opportunity for people to chime in, to ask questions, to talk to me. And one thing I can tell you, I am not as smart as some of you. And the thing about being a professional and a clinician is I realize that people who come to see me, most of those people already understand and know their issues better than I do, and are just listening or looking for someone to just listen. I also want to talk about some of the current events that is impacting the mental health of many people. For instance, the recent shutdown that we went through with our government. I cannot tell you, out of the 800,000 people who were affected just by their paycheck, and we haven't talked about the families that were involved. So when you say 800,000 people, we're not including their children, we're not including their family, we're not including all of the issues that as a fallout of that, and the post-traumatic stress disorder complaints that have gone up exponentially with professionals who are in my field. They're saying they're getting more and more calls of people who were impacted severely by that. See, when person's life is threatened, their security, their safety, their livelihood is threatened, there is an increased level of anxiety that is to be expected, and especially when that is done with some uncertainty and some issue of not being expected. And so we're going to talk about that. So I plan to come to you every night around this time. Matter of fact, I am not off of work yet. I am just wrapping up my work day, and I've got notes and stuff to write, and I got things I got to do before I go home tonight. However, I want to start allowing people who are really dealing with personal issues, I don't have to know your name. I don't have to uh, um, know where you are as geographically located, or if you are, I don't have to know that. But sometimes it's giving a person an opportunity to say, here I am, this is what I'm dealing with, and what do I do with it? I may not have all the answers, but at least there may be somebody out there who's dealing with what you're dealing with. And sometimes when we're in the midst of mental health issues or stressors, now mental health don't mean I'm crazy. It's simply meaning it means that I'm dealing with an impairment. I am being impaired in some way, whether it's socially, occupationally, relational, um, due to something that's going on in my life. That's what mental illness means. It doesn't mean that I'm crazy. It doesn't mean that I need to be hospitalized. It means that for some reason or something is going on that's impairing what my normal function is. And so oftentimes people, because they don't understand what it is, they draw back, or they look for information from people who are not informed. And that's a dangerous place to be. The best thing to do is, when you're dealing with something, to inform yourself, become knowledgeable of what you're dealing with. And I believe the best therapist is an informed therapist. So you become your own therapist. You become the person who knows as much about what you're dealing with, so that you can, find out ways to help yourself. Uh, Let me tell you something about mental illness. Getting back to a place that you would consider help, hope, and healing is something we all do. We all encounter stressful situations. We all encounter things that would impair our relationships. We go through situations and circumstances that some of us would choose not to go through, but we're in them. And what do we do with them when we're in them? Some people are resilient. They bounce back very quickly. Other people may take a while to bounce back. And some people are very, very severely impaired by it. And when you're impaired by it, you have to find a way, or coming to a person like me is trying to help you find a place to get back, or to bridge your way back to what you know as a sense of normalcy. And so I don't want you to, what would help me out, and I'm serious about this, is that if you would share my post, like it, and get it out there so we can join in this effort. People need to know that they're not by themselves. And most of the time when you're going through something, that's what it feels like. I'm alone. Nobody is going through this. Nobody's experiencing something like this. I mean, I'm dealing with marital issues and nobody's dealing with that. Or, I'm dealing with a child that's addicted to some substance and nobody is dealing with that. And the embarrassment and the stigma that is associated with that often impedes our ability to get help. Strange that I was in a conversation today, and I wanted to bring this to light. I'm not going to tell you who the conversation was with, but we got into a conversation about the religious aspect of mental illness. Why is it that people who are in church um, uh, are less likely to seek treatment or seek help? And we were talking about the how most of us are indoctrinated into our beliefs. Uh, when we're children, we are indoctrinated into our beliefs, and some of us, as we get older, begin to question whether that is accurate or not, based on what we're coming to know now. But one of the things that's very hard for many of us to do is to dispel that notion that seeking help mean there's something wrong with me spiritually, that God is upset with me and I have a demon or I have some type of spiritual thing that's been attacking me. Well, I mean, we don't really know where the origin of some of these disorders come from, but I can tell you that most people who are dealing with a disorder, those disorders then just show up today. Most of the time, they find their origin in when we were kids, or the trauma we experienced as a child, or the stuff we watched as our parents were going through issues in life, or things of that nature, things we were exposed to on TV. Um, those things really have a very, very real, serious impact. And there are serious implications to those things in our lives. And the reason why it sometimes takes a long time for those things to appear or to present with themselves is because we find ourselves in a place where we have exhausted our capacity to cope. And I don't want to use uh, clinical jargon to confuse you, but all I'm saying is we've we've exhausted everything that we know to do, and now we're in a place of hopelessness and helplessness, and we're saying, "I need help." And oftentimes that doesn't show up until something really start happening. Relationships are are broken up, or you lose your job, or and that's when those things really become presented in our lives. And so I want to make this place or this particular format. I don't know how to do social media, so I'm going to be talking to my staff who's younger than I am, and folks who know all about the whatever they call it, how they discuss how many people that you reach, and the demographics and all that. I have no idea about that. You have to keep in mind, at my age, I don't want to learn anything new. I'm good with what I know, and I have to leave this up to the millennials and folks who find this an interesting and a very big part of their lives. Well, I don't. I read, I do other things, and I do research, and those have become a part of my life. So it's kind of hard for me to get into, the social media framework. But I'm learning. I'm open to learning. But let me just step back for a minute and tell you a little more about me and my experience. Um, I have been going down this path for learning about mental illness for a long time. I got my first master's in counseling in 2004. I returned back to school and got a second master's in family studies in 2014, and a third master's in professional counseling in 2016. And I have since entered a doctoral program, and I am on target to actually defend my doctoral uh, work this semester, and hopefully by May the 10th, I'll be graduating out and getting out of school. I also have a license as a licensed professional counselor. So I am a licensed professional counselor, licensed in Texas. I am a national board certified counselor. I am a licensed chemical dependency counselor, and I'm a licensed professional healer of arts. And so those are the certifications that I hold. I am or licensures that I hold. I practice cognitive behavior therapy, mindfulness, cognitive mindfulness, acceptance and commitment, narrative enhancement, and several other theoretical approaches that I have received certifications in. And so I'm not coming from a place of naivety. I am coming from a place of professional training and learning, and I'm still, matter of fact, I'm doing some certifications now. I love working with people. I love working with children, adolescents, families, and adults who are dealing with different places in their life that is pretty tough at the moment. I can tell you one thing about mental health is it is treatable, and people can live and exist and go on with their lives dealing with mental illness. And the best thing to do is identifying it and learning to manage it. Just like you would if you had high blood pressure or sugar diabetes, or you were dealing with some other dreadful disease, you would go and get a prognosis, and they would develop a treatment plan, and you would work that treatment plan to mitigate or at least reduce the symptoms or the issue that's at hand. And that's part of what I do as a job. My job is to help people. And I feel good about that. I mean, I enjoy going to work every day. I get up every morning, and sometimes I start at 8 o'clock, and I don't get off till 10 or 11 o'clock at night, but I'm good with it. But I do I do work on me and giving myself some time to just think and read and, uh, you know, behold myself. And part of this platform, beginning tonight, is to give you a place that you can ask a question, or you can open up a conversation, and you can say, "Hey, I am here." And that's what most people need to know, that you're seen, you're heard, and you're understood, and is the best we can, but that you're not alone, and and that people are thinking about you. And so that's what this platform is all about. And again, I want, my heart goes out to the people who uh, some of those people are just not getting their first paycheck today, who were involved with the shutdown. And I mean, it's sad. I mean, that people have taken the lives of the folks who are most vulnerable and played on that, as if those lives don't matter, and they do. And how do you explain it to your children? Children are traumatized. How do I go to school and deal with the worries that my parents have? And children do internalize that. They internalize what is going on in their environment. And so, that being said, there's going to be a whole lot of things going on with that. Not just that, but what's going on with the immigration. Uh, all the lives that are being impacted by that is huge. And we cannot, we don't know the effects of that. We can't tell you what it's going to look like. With some of these, we won't know 10 to 15 years down the line how it has severely impacted the lives of those who have been victimized by it. So there's a lot of things we're going to talk about, current events, things that's going on today, things that I face, and things that I deal with. I'm going to bring those to the forefront. I'm going to talk to you about it. I'm going to bring it open and open the discussion. Again, this is a big jump for me, because I am not good. I mean, my staff, matter of fact, we were in conversation, and they were saying, "You need to go live." I thought, I ain't doing that, man. No, no. Everything has to be scripted. Everything has to be planned out. I have to see it away, and I have to argue my point, and it's a way for me to be able to talk without having to feel. And I can go over it over and over and over again to make sure it's right. That's a part of the issue that I deal with every day, because I have to. I mean, I know that this issue of me having to be perfected all the time. I got to make the best grade. I have to make the best representation. I have to do all the things. I deal with that. So that's my issue. That's not yours. That's my issue. But so not only do I have the academic prowess and the licensures to be doing what I'm doing, I have the experience. I opened up a program back in 2003 that basically worked with children who were in foster care and adoption. And I've been doing that, and I've expanded that program with the help of God. I didn't do it on my own, but I've had wonderful people, qualified people, great people who are professionals help me expand that vision. And today we have offices in San Antonio, Houston, Dallas, Corsicana, and we don't just do foster care and adoption. We do counseling, behavioral health. I go into prisons. I go out and do consultation. I go out and talk to people about ADHD and depression. I talk to teachers in schools and doing service and staff development. So it goes on and on, the things that I do. But I enjoy it. It is my life. It is my normal. And your normal may be different from mine. You may be doing something totally different. But if it's what you enjoy, I encourage you to keep at it. Keep at it. Keep doing it. And so one of my biggest things right now going is, I know that a lot of people, can't and do not have access to services because they don't have insurance. I mean, you got this huge gap. You got people who are on insurance, you got people who are on Medicaid, but you got this gap in between. And I can tell you, just from wrestling with insurance companies and trying to get things pre-authorized and just the rat race of paperwork and documentation, that providers they rather not do it. It's a lot of work for pennies and nickels and all of that. So to close that gap, I have made a conscious decision that I would work and fight for the people who cannot fight for themselves. And I have decided that my practice is going to be one of those practices that people can call on and say, I am in the midst of crisis. Can I get in there? And they have a way in. And we do a lot of pro bono work. And pro bono work is just professional work that's offered at no cost to the person who's coming in. And I decided that God has blessed me, and I'm going to give that forth, and I'm going to bless people who need that help. And strangely, it's most people are disconnected from hurting people who are dealing with mental illness unless it's in their face, unless it's someone that's close to them, or unless they're dealing with it. I was at an event a couple of weeks ago, and a lady walked up to me and just started telling me about her daughter who succumbed to addiction, and it ended up costing her life, and how traumatic it was, and how nobody has really thought in terms of her. She had to keep her life going. She had to continue to go to work. She had to provide for her daughter's child, and she had to act like nothing had happened. She had to just pick up the pieces and keep going. And she was saying, I just need to get somewhere. I feel like my world is closing in, but I keep going because I don't know. I have no other options. And that is very difficult. I mean, that is difficult. I've been in situations where I've had people who lose loved ones, and they've been told by something of faith that God is going to heal it. Well, I didn't say God won't heal it, but that's not a natural progression or process of healing. That people don't understand that when you lose someone, that there is a process that you go through of grief. That person no longer being in that space or that place where they've been known to be. And then how do you pick up the pieces and go on? And so we're going to talk about that. I want you to not be afraid to bring up conversations, to bring up things that are concerning you, and things that you've heard, and misinformation and false information. And I'm good at dispelling that. I'm good at challenging that. I try not to be too analytical and too, because I read a lot of research articles, and I do research myself. So if you ever find me getting too analytical or too, let me give you the word we use in school, scholarly. If I get too scholarly, please say, man, you're too far on the other side. Could you please make it in layman terms so we can understand it? And so we will be covering topics, man, on issues that are real. We'll be talking about neurodevelopmental disorders, things like ADHD, and we'll talk about schizophrenia. We'll talk about bipolar disorder and depressive disorders. We'll talk about anxiety disorders. We'll talk about post-traumatic stress disorders, and I'll even deal with borderline personality disorder, because I have some of them in my practice who I see, and especially substance-related disorders. I think those are all important, because oftentimes we don't. I got into a conversation real quick, and I'll drop this, and I'm getting off this place real quick because I can get to talking. I talked to someone not too long ago, because we had a situation happen in my little town where we had a double murder suicide, and the person said, there's 65% of people that are arrested in this town actually have a substance abuse issue or a mental health issue. And I'm saying, I'm not surprised. If you open the paper and you read all the people who are indicted by the grand juries in your local county, you will find out that a large percentage of those people are arrested for substance abuse or something that's related to it. Domestic violence is related to some of that. Robbery and burglary of habitations and aggravated robbery. Some of those things are related directly to drugs and substance abuse. And so we need to talk about it. We're not going to be ashamed. I'm not going to be ashamed of it. I'm going to talk about it. I'm going to make it a very, very big thing. One of the other things that we're going to talk about is also systems, family systems. Thank you, Regina, for mentioning that. Family systems. Right now, even in my practice, I hardly ever see a child without seeing the entire family, because you can't treat one in a family and not treat the entire family, because the whole family has a contributing part to that stressor or that dysfunction. So oftentimes when I'm in family or if I'm dealing with an individual, that the individual may be my designated patient, but I want to include the family in many aspects of that. Starting with individual counseling is good. I don't have any problem with that. I think that's all a part of it. Oftentimes we do both individual counseling and family counseling. The thing about counseling is what most people don't realize is what is discussed in a counseling a place or that zone is confidential, and confidentiality is a part of that. So as a licensed practitioner, what you tell me in counseling is protected. It is kept there in that room. So even if I'm doing family counseling, whatever you told me in that individual session, I can't bring it out in family counseling at all because of the confidentiality that's involved, that is involved in that. And that has to be understood. The only time we can violate that confidentiality rule is if there is some type of report of allegation of abuse of a child or someone of an elderly, and then we have to, because we are mandated reporters, we have to report that. Otherwise, what is discussed in therapy stays in therapy. And that is a very, very difficult place for a lot of people, because they think, oh, if I tell them, they're going to, expose. Even if you have a substance abuse disorder and you come in therapy with me and I'm treating you for a co-occurrent disorder, and you tell me, oh, I relapsed, and you got a parole officer, probation officer, I can't go and call those people and say, oh, he told me he relapsed. No, I can't do that. Okay, so what is discussed in therapy stays in therapy, and that's very, very important that you understand that's a part of this process in every licensed therapist. Now, I'm going to be an advocate. There are some people out there that's not licensed. You can practice, being a coach and a counselor or a Christian counselor or whatever counselor you want to be without having a license to do that, as long as you don't say, quote, that you are a licensed professional counselor or a licensed marriage and family therapist or a licensed clinical social worker. You can, just as long as you don't promote or advertise yourself as being something you're not, then people can do that. I mean, you have a lot of people come into practices. One thing that I can tell you, though, is whatever you're dealing with, you need to find someone who specializes in that, or at least have some form of training and know the techniques and strategies that are used to address that issue. For instance, when a person is dealing with depression, one of the things we use is cognitive behavior therapy. Cognitive behavior therapy is good for people to modify behavior, change thoughts, or to confront distorted thoughts or false thoughts and beliefs that contributes or that adds to that dysfunction. And so that's a place where we do that. Some of you are, and I'm glad that you all are chiming in, because it's good. This is where we start. How do you deal with someone who need help? Well, the problem with adults, okay, and I tell people this all the time, you can't come to me for another adult. Adult has to come on their own because of informed consent. And remember, what we do in practice, like in therapy, is we have to follow the health or the medical model, which you have a health passport, and that is privy to you, and nobody has access to that. So when you are dealing with a mental illness or a stressor in your life, that person has to be the one that comes forth. Now, let me tell you about motivation. Everybody is not motivated to change. Some people don't think they have a problem. Okay, you think they have a problem, and from your perspective, they do. However, that person hadn't gotten to that place where they see it as a problem. So until that person sees it as a problem, they're going to be what we call they're not motivated to change. Okay, now when they start feeling the motivation to change, then oftentimes they will come at it on their own, and that's a good place for them to be. When they come at it on their own, then we have the access to help them. Oftentimes, and now if it's a minor child, parents can, their guardians, whoever can, they have to approve for treatment and approve services. But again, what a child talks about in therapy is confidential as well. So, I can tell you a progress report. I can tell you, well, they're doing this and they're making these progress or whatever, but I cannot tell you what that child said to me in therapy. That is protected. That is protected information and can't be released without your informed consent. So those are the things that we're going to be dealing with. And I want to help you. I want to be there to give you the information you need. And hopefully that information will empower you to make informed decisions about your own care, okay, which is important. I'm not here to be spiritual. I'm not here to be a Christian and all that kind of stuff. That has its place. And there are people who are able to answer your biblical questions. I will encourage you, so that we don't offend people, to use that in the proper forum in which you can. That means talk to your pastor. I'm not that. I'm not your pastor. So I don't want to give you any information that is contrary to their doctrinal teaching or their beliefs in their articles of faith and all that kind of stuff. So I don't want to challenge any of that. I am simply here as a mental health professional and who's trained to address those issues. And so you can go to my website. You can find out about us. I tried to not be intrusive, and like I said, I don't know it all. I will never know it all. I'm still learning. I'm still learning more about myself and learning how to work with those who do come to see me. As I have become more and more aware of all the needs out there, things are changing. What people are faced with look different than it was when I first came into practice. I got to tell you this because this is really funny. I am now using the smart gadgets to help my kids who come in to come into therapy. I'm giving them assignments that they can Google and they can look up. And I'm giving them apps and giving them things that they can use outside of the therapy room. It's funny. I mean, it's just strictly funny. But and when you see 11-year-olds' eyes go, wow, he knows about the apps. Yep, I do. So I try to stay informed because of that. And sometimes I'm learning. I learned a lot as kids and adolescents come in. They teach me a lot. Parents teach me a lot. And it's amazing when you see people's eyes go, oh, yeah, I remember. That's what they've been doing. That's what that's called. Wow, I didn't know that. So encourage you to chime in every night. I'm going to come back every night around this time at 8 o'clock. By that time, I should be wrapping up in my office and everybody should be gone by then. And it's kind of quiet around my office by that time, and I can just kind of settle in and respond to any questions you may have. Since I'm trying to get used to this, I'm going to try to invite my son on and some other people who can help me manage this contraption of a social media format and teach me how to move this cursor around and read questions, because I have to tell you, and I have to admit, I am a chronic ADHD person. I've lived with it all my life, and I'm also dyslexic. And so that could be a bad combination for some of you who are not. I often teach kids this thing right here. It's called the numbers game. People in a normal world look at numbers as 1, 2, 3, 4, 5. Okay, 1, 2, 3, 4, 5. It equals 15. People in my world see 3, 2, 1, 5, 4. It still equals 15. We still get to 15, but that's my world. And most of the time, because the normal people in society, or the majority of society, fits the 1, 2, 3, 4, 5 with that sequential thing, they want to put us into that category, and I just don't fit there. So I just want you to know that I am seriously ADHD, and I don't mind telling you that. And I think it's a gift. And I tell kids that all the time, that ADHD children are resilient kids, or they end up being resilient adults. Very. I was reading some information the other day, and I was finding out people who had schizophrenia and bipolar disorder. And I'm like, really? I didn't know that. So these things are not a, a detriment or a curse. You have people who have done wonderful things, researchers, actors, people who are inventors, who have some of the things you use. The iPhone, watch this. The iPhone was developed by a gentleman who had ADHD, Steve Jobs. And you use the iPhone. I'm trying to use it. I got two of them just recently. I mean, like this week. I don't know anything about the iPhones yet. So I want to encourage you to give me, to be patient with me. Understand that I'm trying to learn this contraption as well as give you information and work with you as you are chiming in. But if you have any questions, don't feel bad to ask, and I will try to get to everyone that I can. But I also want to tell you we're having an event called Love is in the Air on February the 16th. We're having my little god brother, Bobby Sparks, coming, and he's going to be with us in Corsicana. I know for some of you that may be a drive, but we're going to have a night of fine dining and music, fine dining and music. We're having a wonderful menu, and we have the most prolific professional artists who will be playing the instruments with us that night. We have two shows, one at 5 and one at 9, and you can just kind of get around, hang out, have fun with people and talk and chat while the music is playing, and have a wonderful ambiance of wholeness, and bring your special person that night. Now, you can go on our website and find out how to buy the tickets and purchase tickets. They're going fast, so you better get your ticket and come. Matter of fact, we got Monday, we got a couple of surprises going on, so stay tuned. You'll see them on my feed. We've got some things we're going to be giving away. I think they're giving away 10 tickets for this event. 10 pairs of tickets. 2 tickets for 10 individuals to come. And if you win the tickets, then we want you to be a part of that event. It's going to be wonderful. They're having salmon and vegetables, or you can get chicken, stuffed chicken with some spinach, some with some vegetables, and you got dessert, salad, rolls. I mean, and doing a silent auction, and all the proceeds we raise is going to benefit the Hands in Hands initiative, which we are offering 1,000 hours of counseling services to people who do not have insurance, who cannot afford it, but yet need those services. And I'm glad, because today we got a contribution from a car dealership, and I got a list of other people who've given and helped and support, and so I want to say to those who have, thank you, and the people who need those services. Matter of fact, that was one of the calls I had a discussion with today. There was a person who was suicidal and got into a discussion about what I could do to help. And what came out of the conversation is a person has no insurance. And I said, well, that won't stop us from helping them. Tell them to come. We want them to come. And we want to make sure we can mitigate whatever the crisis is in the moment, so that we can help them get back to what we call a sense of normalcy. And so I look forward to seeing you. I look forward to being a part. Now, I'm going to chime out because I don't want to be here. My staff have told me 30 minutes is long enough, and don't go past 30 minutes. So I got some young people to work with me. I think I'm the oldest thing in this organization. I think I am. I don't think anybody's as old as I am. Yeah, you're right. There's nobody old as I am. Oh, well, that says a lot. I am highly antiquated. Boy, that's a good. But I do have some millennials working this office, and San Antonio and Dallas, and so I'm learning how to use their language and learn their language and know what it's all about. But they can't beat me working. That's one thing about the millennials. They can't beat me working. I work. I mean, I work hard. I put my time and my effort in, and so it's a good thing. So listen, again. Join me tomorrow night, 8 o'clock. I'll be live, okay? And you can give me your questions. You can chime in. I'm going to learn between now and tomorrow how to include my son, little Ricky, on the thing so he can read the question. Now, he's ADHD too, so and so that being said, don't expect for this to be a perfect show, all right? Because like father, like son, he might get it all screwed up, and but he's also a perfectionist, so it's just like me with that. So, but I want you to include yourself, and if you have any concerns about someone else, bring those questions to the forefront. I may not be able to. I don't diagnose people without seeing them. Let me tell you that. I don't diagnose people without doing an assessment and evaluation. And but I'm doing more and more court related work. Funny, I got a call, was it yesterday, about a drug case where the police department was trying to enhance a criminal conviction over marijuana because of a daycare in the area. In the daycare I used to own, it's been closed for years. Yeah, right. Hmm. So that goes to show you that we're still dealing with some issues, and still dealing with some things that's going on. And the daycare been closed for years. And hey, I'm just telling the truth. And so we want to help. And I'm doing a lot with some attorneys here, working as an expert witness. I do tests and I assess people for substance abuse and depression, and I do all kinds of assessments and stuff, and I write up reports, and that's a part of what I do as a clinician. So I do a lot of things. So I'm not just do therapy, but this is going to be an exciting thing for you. I want you to share this post. I think it's like and then share. Well, whatever, something like that. Like and share it, and then let people see it, so that your people on, I think it's your people on your feed. Let me ask Jason again so she can explain to me how it goes. But I think she told me if they like and share it, other people on their feed can see what we're talking about. Well, whatever. You know what I'm talking about. Let's have fun with it. It's not too serious, but it's enough to open up and give you an opportunity to speak and share your heart, share your concerns, and ask your questions. Well, until tomorrow night, I will see you in just 24 hours, or well, 23 hours now, but I'll see you tomorrow night. I'm going to try to get other people to come in and join me and talk about some of the things that's going on with them too. And as I said, this is open to you. And if I say something that hurts your feeling, tell me. If you think I'm wrong or not uh, accurate in a place, I'll take that, but I'm going to go do my research. I'm not going to take your word for it. I'm going to come back with some information. And so let's keep that going. And I love to see you on tomorrow. But Monday through Friday, 8 o'clock every night, I'm going to be right here in this chair talking to you about mental health and how to regain help, hope, and healing. And nothing is over until the fat lady sings. And since you're still alive, you get, no, that wasn't right. See, that's why I don't like to do live stuff. See, because I always say something that will get me in trouble. There's nothing wrong because I am, don't worry about that. Okay, so until tomorrow night, I'll see y'all at 8 o'clock. Good night. Have a good one.